Have you ever woken up, rolled over, and realized your pillow is damp? For a lot of people, that happens once in a while and it's no big deal. But if you're noticing it more and more often, or if you're waking up with a wet pillow, dry mouth, bad breath, or even a sore throat, your body might be trying to tell you something important. And here's the truth. Nighttime drooling isn't just aging. It can be totally harmless, or it can be a quiet warning sign that something deeper is going on with your breathing, digestion, nerves, or even your medications. Now, before we go any further, I want to reassure you. Drooling during sleep is extremely common, especially in deeper stages of sleep when your muscles relax and your swallowing reflex slows down. But according to many sleep specialists and major medical institutions like the Mayo Clinic and Cleveland Clinic, when drooling becomes frequent or excessive, it's worth paying attention to, because it often shows up alongside other issues like poor sleep, reflux, mouth breathing, or neurological changes. So in this video, I am going to walk you through 8 common health conditions that can cause excessive drooling at night. And I am not doing it to scare you. I am doing it so you can feel in control, because most of these causes are manageable, and some can be improved quickly with simple changes at home. Here's what we'll cover: the most common sleep-related reason people drool, and what it says about your breathing, the digestive problem that quietly increases saliva at night, and how to spot it early, dental and jaw issues that can trigger drooling without you realizing it, why allergies and sinus congestion often cause drooling even in people who don't think they have allergies, neurological conditions where drooling can be an early clue, mouth and throat infections that temporarily increase saliva, a lesser-known digestive connection many people underestimate, and finally, medication side effects that quietly increase saliva flow. Along the way, you'll also share simple, science-backed tips you can try immediately, like the best sleeping position, how to reduce mouth breathing, and what to track before your next doctor or dentist visit. Because one of the biggest mistakes people make is ignoring drooling for years, until it turns into poor sleep, chronic fatigue, worsening reflux, or even dental damage from sleeping with an open mouth. Now, one important note: this video is educational. If your drooling is severe, sudden, or paired with symptoms like choking, slurred speech, facial weakness, or new swallowing problems, please contact a healthcare professional right away. Alright, let's start with the number 1 reason so many adults over 55 drool at night. And it has everything to do with how you breathe when you sleep. Number 1. Sleep apnea, or poor nighttime breathing. If you or your partner has noticed snoring, gasping, or pauses in breathing, sleep apnea may be the reason your pillow is damp in the morning. Here's what happens. When your airway partially collapses during sleep, your body instinctively tries to pull in more air. Many people do that by opening their mouth, especially when the nose is even slightly blocked. Now, when your mouth is open and your swallowing reflex slows down in deep sleep, saliva collects and can leak out. But it's not only the open mouth. Sleep apnea also disrupts the normal automatic swallowing your body does at night. So, saliva builds up faster than you can swallow it. Extra clues. Sleep apnea may be involved include waking up tired, even after enough sleep, morning headaches, dry mouth, frequent nighttime urination, or high blood pressure that's hard to control. Why this matters? Untreated sleep apnea doesn't just cause drooling. It can increase the risk of heart strain, stroke, memory issues, and daytime fatigue. Quick tip you can try tonight: sleep on your side instead of flat on your back. Side sleeping helps keep the airway more open and often reduces mouth breathing. Some people also benefit from a wedge pillow to elevate the upper body slightly. Number 2. Reflux disease, or GERD. This one surprises many people. If stomach acid rises into the esophagus while you sleep, your body tries to protect itself by producing more saliva. Saliva contains natural compounds that help neutralize acid. So reflux doesn't just cause heartburn. It can trigger extra salivation, and when you're lying down, that saliva can flow out, especially if your mouth is open. Signs reflux could be the cause include heartburn, a sour taste, chronic cough at night, hoarseness, or feeling like something is stuck in your throat. Practical lifestyle upgrade: avoid heavy meals within 3 hours of bedtime. Elevating the head of the bed just a few inches can also reduce reflux episodes. Number 3. Dental or jaw problems. Your mouth and jaw are deeply connected to saliva control. Inflamed gums, tooth decay, poorly fitting dentures, or jaw misalignment can all increase saliva production, almost like your body is trying to wash away irritation. pain, or an uneven bite can also make you unconsciously sleep with your mouth open, which promotes drooling at night. If dental issues are involved, you may notice bleeding gums, bad breath, jaw clicking, soreness, or dentures that feel loose. If drooling comes with mouth discomfort, don't wait months. This is one of the easiest causes to fix, and it can prevent bigger problems later. Number 4. Allergies and sinus infections. If your nose is blocked, your body has only one option at night: mouth breathing. And mouth breathing is one of the fastest ways to increase drooling. Allergies, hay fever, chronic sinusitis, and even a deviated septum can keep your nose partially blocked for months or years. Clues include waking up with thick mucus, postnasal drip, sneezing, itchy eyes, facial pressure, or seasonal snoring. Practical home support: use a saline spray before bed, run a humidifier if your room is dry, keep bedroom air clean, and sleep slightly elevated so mucus drains better. Number 5. Neurological conditions. This is more sensitive, but important. Conditions like Parkinson's, multiple sclerosis, ALS, or stroke-related changes can affect the muscles used for swallowing and facial control. In many cases, the issue isn't too much saliva. It's swallowing less often, so saliva builds up and spills out. And at night, when muscles relax even more, drooling may become more noticeable. Warning signs that should prompt a doctor visit include drooling while awake, changes in speech clarity, trouble swallowing pills or foods, tremors, stiffness, balance issues, or facial weakness. Most nighttime drooling is not neurological disease, but if it appears suddenly or comes with swallowing changes, it's important to get checked. Number 6. Infections in the mouth or throat. When your mouth or throat is irritated, your body produces more saliva to flush out germs. This happens with tonsillitis, pharyngitis, mouth ulcers, colds, and flu. Clues include painful swallowing, fever, swollen glands, red throat, mouth sores, or drooling that started suddenly during illness. Warm saltwater gargles and staying hydrated can help, but if symptoms worsen or persist, get medical care. Number 7. Digestive disorders, and in rare cases, parasites. Most people never connect digestion with drooling, but your digestive system and saliva glands are linked. When your stomach or intestines are irritated, your nervous system can trigger extra saliva production. Certain digestive disorders, like chronic gastritis, indigestion, nausea, or food intolerances, may increase salivation. Parasites are much less common in the U.S., but can happen, especially after travel or exposure to contaminated water. If you're concerned, don't ask your doctor about stool testing. Number 8. Medication side effects. This is one of the most common overlooked causes. Some medications increase saliva flow or relax the muscles of the mouth and throat. Others slow the swallowing reflex by causing mild sedation. This can happen with certain antidepressants, antipsychotics, Parkinson's medications, some antibiotics, sleep aids, and anxiety medications. If drooling started after a new medication or dosage change, that's a strong signal. Bring your full medication list, including supplements, to your next appointment. Sometimes, a timing change or alternative medication can fix the problem. What to do next? Simple checklist. First, notice the pattern. Is it seasonal? After late dinners? Only when you sleep on your back? Second, check for the big clues: snoring, choking at night, severe reflux, swallowing changes, facial weakness. These need medical attention. Third, try the easy fixes for 7 nights: side sleeping, slight head elevation, saline spray or humidifier, and no heavy meals near bedtime. And fourth, if it continues, talk to a dentist or doctor, because persistent drooling is often connected to something treatable. Here are the 8 most common causes again: sleep apnea, reflux, dental or jaw problems, allergies and sinus infections, neurological conditions, mouth or throat infections, digestive disorders, and medication side effects. Drooling doesn't happen for no reason. It usually comes from mouth breathing, increased saliva production, reduced swallowing, or all 3. And when you understand which one is driving it, the solution becomes much clearer. You can't stop aging, but you can listen to your body earlier, make small changes, and improve comfort, energy, and sleep often faster than you expect. Your body isn't failing, it's communicating. So here's my question for you: Which of these causes feels most likely for you? Sleep apnea, reflux, allergies, dental issues, or medication side effects? Write it in the comments. Your answer could help someone else feel less alone. And if this video helped you, please subscribe for more calm, science-backed health guidance for life after 55. Because you deserve clear information and real peace of mind.